Vaccination is the process of generating a protective adaptive immune response against microbes by exposing the body to non-pathogenic forms of microbes or components of microbes. There are four main types of vaccines: live attenuated, inactivated, subunit, and toxoid vaccines. Live attenuated vaccines contain pathogens that have been weakened in the laboratory, and they're used to protect against measles, mumps, rubella, and varicella, the MMRV vaccine, rotavirus, polio, the oral polio vaccine or OPV, influenza, the nasal flu vaccine, and yellow fever. Inactivated vaccines use a pathogen that has been killed in the laboratory and include vaccines against hepatitis A, polio, the inactivated polio vaccine or IPV, and influenza, the inactivated influenza vaccine. Subunit vaccines contain just a portion of the pathogens, like polysaccharides or proteins, and this is done in vaccines against Haemophilus influenzae type B, hepatitis B, human papillomavirus or HPV, Bordetella pertussis, Streptococcus pneumoniae, Neisseria meningitidis, and Varicella zoster virus. Finally, toxoid vaccines contain inactivated toxins produced by pathogens, and this is used in vaccines against Clostridium tetani, which makes tetanus toxin, and Corynebacterium diphtheriae, which makes diphtheria toxin. Toxoid vaccines are often combined with subunit vaccines to make a stronger or a more immunogenic vaccine. For example, the Tdap and Dtap vaccine provides coverage against the toxins for tetanus and diphtheria, as well as the toxin and non-toxin antigens that are part of pertussis. All of these vaccines can be administered one of four ways: intramuscularly, intradermally, subcutaneously, or orally. Every year, each country publishes a routine vaccination schedule that includes which vaccines a child should be given depending on their age, as well as vaccine contraindications. One contraindication for all vaccines is having a severe allergic reaction like anaphylaxis when given a previous dose of vaccine, or having that sort of reaction to any vaccine component. Another one is having a moderate or severe infection with or without fever, and that doesn't include having a mild upper respiratory tract infection. For intramuscular, intradermal, and subcutaneous injections, there can be pain, swelling, or redness at the injection site. There can be systemic symptoms like fever, malaise, headache, loss of appetite, and irritability. These typically start within 24 hours of the injection and improve over 2 days. Now, in rare situations, so between 1 in 100,000 and 1 in a million, there can be more serious reactions. For example, more redness, spanning more than 3 inches or 7.5 centimeters at the injection site, prolonged irritability, a fever above 104 degrees Fahrenheit or 40 degrees Celsius, seizures, thrombocytopenia, or even anaphylaxis. With these rare situations, it's sometimes hard to know if it was due to the vaccine itself or from something else. In any case, even when accounting for these sorts of rare situations, the benefits from avoiding the diseases still far outweighs the risks from the vaccines. Some strategies that decrease pain for infants are breastfeeding or giving sweet-tasting solutions during the vaccination procedure, distraction techniques and tactile stimulation, which means rubbing near the injection site prior and during the injection, then for all children, optimizing the injection technique. For example, avoiding aspiration, which worsens pain, and ordering the vaccine so that the most painful one is administered last also seems to help. Topical anesthetic creams like 5% lidocaine may also be applied to decrease pain. On the other hand, giving oral analgesics like acetaminophen or ibuprofen before the vaccine are not recommended. Okay, now let's dive into the US vaccination schedule. We'll start with the hepatitis B vaccine. It's a subunit vaccine against the hepatitis B virus, which is a major cause of hepatitis and liver cancer. It's administered intramuscularly in a total of 3 doses. The first dose is usually given immediately after birth and at least within 24 hours of birth if the mother is negative for hepatitis B surface antigen, or HBsAg, and the infant weighs more than 2,000 grams. If the infant weighs less than 2,000 grams at birth, then the first dose is given at 1 month of age. If the mother is positive for HBsAg, regardless of the infant's birth weight, the first dose is given within 12 hours of birth, along with a dose of hepatitis B immune globulin, or HBIg for short. Now, if the mother's HBsAg status is unknown, we once again give the vaccine within 12 hours of birth, regardless of birth weight. In infants weighing less than 2,000 grams, this is given together with a dose of HBIg. But if the infant weighs more than 2,000 grams, we go on to check for HBsAg, and if it's positive, we then administer a dose of HBIg within 7 days. In all cases, the second dose is given between 1 and 2 months of age, and the third dose is given between 6 and 18 months. The vaccine is contraindicated in infants with a severe allergic reaction to baker's yeast, like that contained in bread, because it's a vaccine component. Next, there's the rotavirus vaccine, which prevents rotavirus diarrhea, a major cause of dehydration and mortality in children worldwide. There are two versions of the rotavirus vaccine, both of which are given orally: a monovalent one, or RV1, which protects against a single virus strain and is given in 2 doses at ages 2 and 4 months, and a pentavalent one, or RV5, which protects against 5 viral strains and is given in 3 doses at ages 2, 4, and 6 months. Both of them are effective and safe, but since they're live vaccines, they're contraindicated in immunodeficient individuals. The vaccine carries a very low risk of intussusception, so it's contraindicated in children with a history of intussusception. Alright, now the DTaP vaccine protects against diphtheria, which causes a severe form of pharyngitis that can cause airway obstruction, tetanus, which causes muscle spasms and respiratory arrest, and pertussis, which causes apnea in infants and whooping cough in young children and adults. Another vaccine is Tdap, which also protects against tetanus, diphtheria, and pertussis, but contains a reduced concentration of the diphtheria and pertussis antigens. There's also the TD vaccine, which protects against tetanus and diphtheria, but not pertussis. DTaP is given intramuscularly in a total of 5 doses, at 2, 4, and 6 months, and then at 15 to 18 months, and finally, between 4 and 6 years. 1 dose of Tdap is given intramuscularly between 11 and 12 years of age. After that, TD is given intramuscularly as a booster every 10 years. Now, besides the routine childhood vaccination schedule, a person might need a TD booster or a tetanus immunoglobulin, or TIG for short, or both of these if they have a wound. If an individual has received less than 3 tetanus toxoid doses from any vaccine over their lifetime, then TIG is given along with TD. Individuals that have received at least 3 tetanus toxoid doses over their lifetime, regardless of how long ago, don't need TIG, but may need TD. If the wound is both clean and minor, and the last dose of tetanus toxoid was given over 10 years ago, then we give a TD booster. If the wound is dirty, for example contaminated with dirt, feces, or saliva, no matter if it has been washed out, or severe, like a deep penetrating or puncture wound, and the last dose was given over 5 years ago, then we give a TD booster. One contraindication to the DTaP and Tdap vaccines is signs of encephalopathy, like coma, altered level of consciousness, or seizures within 7 days of a previous vaccine dose. That's because encephalopathy was associated with an older whole-cell pertussis vaccine preparation. Another contraindication is for individuals that developed Guillain-Barré syndrome within 6 weeks of a previous vaccine dose, because Guillain-Barré syndrome has been linked to the Tdap, DTaP, and TD vaccines. Next, there's the Haemophilus influenzae type B, or Hib vaccine, which has virtually eradicated Haemophilus influenzae type B infections, which used to be a major cause of epiglottitis, pneumonia, and meningitis. It's given intramuscularly in 4 doses, at 2, 4, 6, and 12 to 15 months, and there are no specific contraindications. The pneumococcal vaccine protects against Streptococcus pneumoniae, which causes various infections including pneumonia, meningitis, and ear infections. There are 2 types: a 13-valent pneumococcal conjugate vaccine, or PCV13, which covers 13 different types of Streptococcus pneumoniae, and a pneumococcal polysaccharide vaccine, or PPSV23, which covers 23 different types. PCV13 is given routinely in 4 doses, at 2, 4, 6, and 12 to 15 months. And PPSV23 is given to children older than 2 years of age with special medical conditions, specifically children with chronic heart or lung disease, diabetes mellitus, cerebrospinal fluid leaks, and cochlear implants should receive a single dose of PPSV23 at least 8 weeks after the PCV13 series is complete. Children with sickle cell disease or other hemoglobinopathies, congenital or acquired asplenia or splenic dysfunction, HIV infection, chronic renal failure or nephrotic syndrome, congenital immunodeficiency, or treatment with immunosuppressive drugs or radiation therapy should receive 2 doses of PPSV23. The first dose at least 8 weeks after the PCV13 series is complete, and a second dose at least 5 years later. There are no specific contraindications. Next are the polio vaccines, which have nearly eliminated poliomyelitis around the world. In the US, the inactivated polio vaccine, or IPV for short, is used. It's given intramuscularly in 4 doses, at 2 months, 4 months, 6 to 18 months, and 4 to 6 years. It's contraindicated in individuals that have a severe allergy to the antibiotic neomycin, which is a vaccine ingredient. Although it's not a live vaccine, it should be avoided during pregnancy. There's also an oral polio vaccine, or OPV, which is still used in some countries where polio is endemic. This is also contraindicated in cases of severe allergy to neomycin, and since it's a live vaccine, it's also contraindicated in pregnant females and immunodeficient individuals. Okay, now the MMRV vaccine is a live vaccine that protects against measles, mumps, and rubella, while varicella protects against 2 clinical diseases, chickenpox and zoster. MMRV is given subcutaneously in 2 doses, one at 12 to 15 months and one at 4 to 6 years. It's contraindicated in individuals that have a severe allergy to gelatin or the antibiotic neomycin, both of which are vaccine ingredients. And since it's a live vaccine, it's also contraindicated in pregnant females and immunodeficient individuals or those with a strong family history of immunodeficiency. It's also used with caution at the discretion of the healthcare provider in those with prior seizures or even a family history of seizures or thrombocytopenia, because the vaccine carries a small risk of febrile seizures and a small risk of thrombocytopenia. If the child has also recently received antibody-containing blood products like IVIG, packed red blood cells, whole blood, fresh frozen plasma, or platelets, it's better to wait for at least 3 months and perhaps up to 11 months, depending on the dose and type of blood product, because it can interfere with the ability of the vaccine to produce immunity. Next, there's the hepatitis A vaccine that protects against hepatitis A, which is normally spread by the fecal-oral route. It's given intramuscularly in 2 shots, and both are given between 12 and 23 months of age, 6 months apart. And there are no specific contraindications. The HPV vaccine is a subunit vaccine that protects against human papillomavirus, which is the most common cause of genital warts, cervical cancer, and penile cancer. It's given in 2 doses. The first dose is given to males and females 9 to 14 years old, and the second dose is given 6 to 12 months later. In older adolescents and young adults 15 to 26 years old, 3 doses are given. The first dose is given, and then the second dose is given 1 to 2 months later, and then the third dose is given at least 6 months after the second dose. There are no specific contraindications, but it's not recommended in pregnant females, although it's not a live vaccine. Next, there's the meningococcal vaccine, which protects against Neisseria meningitidis. There are 2 types of meningococcal vaccines: a conjugate vaccine that protects against serogroups A, C, W, and Y, and is given intramuscularly to all 11 and 12-year-olds, with a booster dose given between the ages of 16 to 23. There's also a serogroup B meningococcal vaccine, which is given intramuscularly as 2 doses, 1 to 6 months apart, to children over 10 years that have an increased risk of meningococcal disease, like those with anatomic or functional asplenia, sickle cell disease, complement deficiency, and those that are exposed to a serogroup B meningococcal disease outbreak. Neither of the vaccines have specific contraindications. Next is the influenza vaccine, which prevents the flu. There's an inactivated influenza vaccine, which is given intramuscularly, and a live attenuated vaccine, which is given as a nasal spray. The first time an individual gets the vaccine, 2 doses are recommended, and after that, an annual vaccine every year is recommended. The inactivated influenza vaccine can be given to everyone 6 months or older, while the live attenuated can be given to individuals between the ages of 2 and 50. Both vaccines are formulated every year based on flu strains that are thought to be the predominant ones that year. The vaccine is thought to potentially carry a low risk of Guillain-Barré syndrome, so in individuals who previously developed Guillain-Barré syndrome within 6 weeks of a previous influenza vaccine, it should be used with caution at the discretion of the healthcare provider. The live attenuated vaccine is also contraindicated in pregnant females and immunodeficient individuals. Despite the common misconception, egg allergy is no longer considered a contraindication to the flu vaccine. Alright, now there's also a live attenuated yellow fever vaccine, which protects against yellow fever. It's recommended as a single subcutaneous shot for people 9 months or older who travel to endemic regions of Africa and South America. For people who remain at risk, a booster dose is recommended every 10 years. It's contraindicated in individuals who have a severe allergy to vaccine ingredients like eggs, gelatin, or chicken protein. And since it's a live vaccine, it's contraindicated in immunodeficient individuals. It can be used if needed in pregnant females with caution at the discretion of the healthcare provider. Okay, that was a lot of vaccines, so many parents worry that this means too many needles being put in their child. So new combination vaccines combine multiple vaccines in a single shot. For example, Pentacell is a combination of DTaP, IPV, and Hib, which may be given at 2, 4, 6, and 15 to 18 months of age. And Pediarix is a combination of Hep B, DTaP, and IPV at 2, 4, and 6 months of age. Fewer injections means less pain for the child, less stress for the parent, less cost for the healthcare system, and more children getting the recommended vaccinations on time. Some parents are worried, though, that getting exposed to so many antigens at the same time might overwhelm a child's immune system. But we literally encounter thousands of antigens every single day, and our immune system is perfectly capable of fighting them off. Delaying vaccines ends up delaying protection for an infant. Alright, as a quick recap, vaccinations are aimed at preventing potentially lethal infections. Routine vaccinations for most healthy children in the US are hepatitis B, which is usually given at birth, 1 to 2 months, and 6 to 18 months, rotavirus, in which RV1 is given at 2 and 4 months, and RV5 also at 6 months, diphtheria, tetanus, and acellular pertussis, or DTaP, which is given at 2, 4, and 6 months, 15 to 18 months, and 4 to 6 years, Tdap at 11 to 13 years, and TD as a booster every 10 years. Next, Haemophilus influenzae type B, or Hib, is given at 2, 4, 6, and 12 to 15 months, pneumococcal PCV13 at 2, 4, 6, and 12 to 15 months, and PPSV23 to children at an increased risk for pneumococcal disease, inactivated polio vaccine, or IPV, at 2, 4, and 6 to 18 months, measles, mumps, rubella, varicella, or MMRV, at 12 to 15 months and 4 to 6 years, hepatitis A as 2 doses between 12 through 23 months of age, human papillomavirus, or HPV, as 2 doses in 9 to 14-year-olds and 3 doses in 15 to 26-year-olds, meningococcal ACWY in 11 to 12 and 16 to 23-year-olds, and B serotype in adolescents 10 years or older at an increased risk for meningococcal disease, and influenza vaccine yearly after 6 months of age. The yellow fever vaccine is recommended for travelers to endemic areas. Contraindications to all these vaccines include severe allergic reactions after a previous dose or to any component of the vaccine, and moderate or severe acute infections. Some special contraindications are yeast allergy for Hep B vaccine, neomycin allergy for IPV, gelatin or neomycin allergy for MMRV, and eggs, gelatin, or chicken protein allergy for the yellow fever vaccine. History of intussusception is also a contraindication for rotavirus vaccine, encephalopathy or Guillain-Barré syndrome for DTaP and Tdap, and all live vaccines, so MMRV, rotavirus, OPV, and live attenuated flu vaccines are contraindicated in cases of pregnancy and immunodeficiency, except for the yellow fever vaccine, which is only contraindicated in cases of immunodeficiency and can be used with caution during pregnancy. HPV and IPV vaccines are also not recommended during pregnancy. Side effects of vaccines range from mild swelling at the site of the shot to seizures or anaphylaxis. Combination vaccines allow more than one vaccine to be administered with one shot.